Welcome to the St. Louis Pain Expert Podcast. I'm your host. I have with me here today Dr. Nate Kadlacek. He is a back pain expert, movement expert, and he's looking to change the healthcare system of the way that we treat, from moving from a illness practice to keeping people well and working with people to change their lifestyle habits over the long term. So, Nate, thank you so much for joining us today.
Yeah, thanks for having me, Dave.
So we were in a Facebook group recently talking with some researchers that we mutually know, and you'd asked a question about if there's any research out about if exercise practices carried out over a long term, say a year or more, helps people with chronic pain. And I think the mutual conclusion was there isn't, and there probably can't be, because there's one big factor that would get in the way, and that's adherence. That if people stick to it, chances are they'll get better, but there's a large drop-off rate. So can you explain a little bit about some of the results that you've seen with patients who have adhered to an exercise program for a year or more? And then we'll get more down to how to do that if you have chronic pain, because if it hurts, you tend not to want to move, but you need to move to make it stop hurting. So it's kind of a catch-22.
It is. Yeah, no, that's a great question. Let me start with a story. And I asked this client of mine if I could use her real name and real experiences, and she said yes, totally fine. So just putting that out there. So Danielle is a client that I've worked with now for over 2 years. She had an injury that happened. It wasn't work related, but there was a lot of things going on in her life at the time. Just I think her marriage was dissolving at the time. Her son was really young. She had developed some pain in her glute and low back, and this just continues to get worse and worse and worse. And this was over 5 years ago, right? So this was a long time ago. Actually, it was 5 years ago when we met. So 7 years ago now, right? And things just continued to get worse. She wasn't able to really work anymore. She was barely able to take care of her son. When we met in 2020, in October 2020, she could only walk 200 steps to her mailbox. And that was it. Like any more than that, and she would just have a horrible flare up of just sciatic type pain down her leg. She'd gone through physical therapy, didn't work for her. She tried a bunch of different things, hadn't really worked for her. She couldn't even drive her son to school. It was only a mile away. So it's not like it was super far away, but just getting into the car and doing the motion of plantar flexion to press the gas pedal down just would flare things up horribly. So she couldn't even drive. So, and she's not like 80. She was 37 when we met. So this is somebody who used to go to the gym all the time. She was fit. She could leg press over 300 pounds, like squat, deadlift. She could do all those things. So I think one of the common things that people who don't have chronic pain often will say is, well, they just weren't active or they weren't fit before. But the reality is that a lot of people who are now struggling with chronic pain, they used to be super fit and active, right? Like, I don't know if you've probably seen this too, but I know lots of my friends who are physical therapists have seen this, where it's not like people were active and fit. It's not like they weren't doing anything and symptoms just like crept up immediately. So I just want to kind of obliterate that myth. But so she was really active. This happened to her. And in October 2020, when we met, she was on the verge of just giving up. Just like, she's like, okay, I'm just throwing in the towel. This is what my life is going to be. Just like really hardcore depression at the time, just not knowing like how she's going to care for her son, who was less than 10 at the time. So young, lots of energy, right? And we just happened to meet because this was during COVID. I started my Facebook group, which grew crazy fast. It was for back pain. I'm not running that anymore, really. But she joined it, and we just hit it off. She saw what I was doing with people. She saw kind of the message that I was putting out there that was, hey, there aren't quick fixes, but if you do something for long enough, consistently enough, it's likely that you will see the benefit. And she just had that mindset. Like on the first call that we had like this, I remember her telling me, she's like, I will do this as long as it takes to get better for myself and my son. Like I can't live like this anymore. And that mentality that she had, I think, is a big part of why she's done so well, because she had something, her son, and just her parents are getting older too. They have some health conditions she has to help them with. So she knew that she's like, okay, I have to like be able to be there for my family. And so she had something out there that would give her the motivation on days that she just didn't want to do it, where she would get up and go. And so that was a big important part. And then just the fact that we were consistent, that she was consistent with her movement routine over the course of 18 months. She, like, for the first 6 months, we were just testing things. We were testing different movements, changing up the walking speed, changing up the walking duration, changing up different types of exercise and movement. And I'll be honest, like there were several times where she flared up pretty bad, and it lasted for a couple weeks. And this is a big part of why people drop off, is because they assume that they try something new and then it flares them up, that, okay, well, this just means that all movement is bad for me, and this is therefore just going to be the rest of my life. I want to really correct that and say, yes, there are going to be times where you get flared up, especially when you're trying to really like address a problem. And it might be that you get flared up for a couple of weeks, even a month. And that's super hard to deal with. That is really, really difficult. And if you're doing it on your own, yeah, I mean, it's really hard to get through that on your own. Even if you're working with a therapist, that's really difficult, because maybe they didn't set the expectation for you that, hey, like, you are going to flare up. Like, it's not if or when, like you just are. And we're going to try to avoid it as much as we can. And we're going to come up with a game plan to reduce that from happening or reduce the intensity. But we need to set those expectations from the very beginning with people who have been dealing with these things for a long time. And this is the expectations I set with Danielle. I said, hey, we're going to do our best to give you really small bite-sized pieces of movement just to work on some of your functional deficits that you're having. For example, like bending over, she couldn't do it, just to even pick things up from the floor. So we started implementing little bending routines here and there just to slowly increase range of motion. And we had to go incredibly slow over the course of a year in order for her to make significant progress. The problem with traditional physical therapy, and cut me off at any point if I'm just going on a tangent.
You're good.
Okay. But the problem with traditional physical therapy and just healthcare in general is that the way that the system is directed is oftentimes you go to PT for 2 times a week for 6 weeks, or even let's say 2 times a week for 3 months, right? The problem is that the way that physical therapy is often billed is you have to be there for a certain amount of time. This is if you're using insurance. It's a little bit different for cash-based providers, but even still, there's generally a time component with it. And so the issue is when you have chronic pain and it's really irritable, sometimes the only thing that you can tolerate is 1 set of 10, right? 1 set of 10 of one exercise. And that might be your movement for the day. Now, this seems incredibly small, but the problem is that when you're going to PT a bunch of times, sometimes the therapist has to put you through like 5 or 10 different exercises to be able to fill the time up, right?
Yeah, they got to fill that half-hour slot, yeah, or hour, or whatever. Yeah,
exactly. They can't just have you do 1 set of 10 and then you're there for 5 minutes and it's all right, see you later. So unfortunately, the system that we have, it works for people who are generally going to get better anyways, where it doesn't really matter the exercise dosage, they just need to move. But for somebody who is super irritable in terms of their symptoms getting worse with very small amounts of movement, having a time-based treatment paradigm is probably the worst thing that you could do for somebody who can't tolerate it, because the incentive is all wrong. And so it is just my opinion. I'm happy to be proven wrong on this or just hear different perspectives. But I think that instead of saying, okay, we need to fill this much time, or like you paid me X amount of dollars for this much time, that we need to think about it more of what is the optimal dosage of movement for this particular person. Does that mean it's going to take 2 minutes per day on their own time? Is that going to be 5 minutes, 10 minutes, whatever it is it going to be one exercise, two exercises? And then maybe the time that we spend together is just going to be discussing how to best move forward and maybe addressing some of the fears that you might have, kind of addressing like, hey, I know you're in a flare up. Let's figure out a way to minimize this, either using like ice, heat, massage, other types of modalities to kind of calm things down. And just really learning more about movement and the science behind pain, versus just using that time for exercise. And you can use those the sessions too for changing the form on certain exercises to make it feel better, and making adjustments that way. But I think, again, just to kind of summarize, that we need to come up with a more innovative approach to helping people with chronic pain where they get irritated really, really quickly, because the current system that we're using is not working.
I totally agree. And you brought up some great points. I'm just going to kind of summarize those really quickly, and you can correct me if I didn't catch any of those. But first, dispelling that myth that people who live in chronic pain are just lazy, that they don't take care of themselves, that they're couch potatoes. In fact, sometimes I think it's harder for people who have been at the top and then fallen so far that to see where they once were and where they now are. It's just really depressing. The other part about just the stick with itness, having something to get better for, having a motivation that I need to get better for, my child, for my parents, for whoever else may depend on me. If you're just doing it for you, then there may not be as big of a motivation. Or if you're just trying to do it to get rid of the pain and not for some larger, greater good, then there may not be such a great motivation. But if you have something bigger or external to yourself that drives you forward, then there is that motivation, and you can stick it with it long enough to actually see results. They say a lot of people turn back 10 feet from gold, and I think we see that a lot in physical therapy. Sometimes it's 100 feet from gold or 10 miles from gold, because it just hurts, and you say, oh, forget it, this isn't for me. And then finally, just that paradigm of, we need to change the practitioner's role from being a personal trainer who counts the reps and says, do 5 sets of 10 of these 3 different exercises, or 3 sets of 10 of these 5 different exercises, to more of a coach and an educator. And I think that's really why we're both here today, is to educate people and empower them to do things on their own time when they're not with you or I or another physical therapist. So thank you for raising all those good points. Let's kind of talk about how someone who is in chronic pain gets started on that process, because there is that temptation and motivation to just want to say, forget it. Yeah, I'm too far into this hole. I'm just going to have to live with it for the rest of my life.
Yeah, that's a great question. So I'm gonna pull kind of the ending of the story from Danielle. She can now walk 10,000 steps. She could only walk 200 steps. And this was in 2020. Now it's 2022. She likes Dragon Con. It's kind of like the Dungeons and Dragons of Comic Con. But she can now go to those conventions, which was a huge part of her enjoyment. She can fly there. It's amazing. So she can now walk 10,000 steps. She can drive her son to school. She can be there for her parents. And this is somebody who literally could not walk 200 steps. So where we got started was we looked at, okay, what are your current functional abilities? How far can you walk? What are all the different, bending forward, bending backwards, side to side? Can you get up from the floor? Can you do a squat? All of these little things that you need to be able to do to basically function as a human, right? And I look at those, and then we start at the smallest dose. I like to start everybody as they're capable on a walking program, focusing on steps, not focusing necessarily on the going a mile or anything like that. But okay, if you can walk 200 steps, great. Let's do that once per day. And maybe if that's too much, we break it into 100 steps twice per day. And so we find something very attainable, something that's not something that you can do very successfully, and then we build from there. And you might be thinking like, well, what in the world is doing 100 steps twice per day going to do for me? And what it's doing for you is it's not going to change you physiologically necessarily, right? It's not going to magically build a bunch of bone density or muscle mass or like increase your cardiorespiratory capacity by just doing that, right? But think about it this way. You are increasing your ability to show up and move even when you have discomfort, right? So you showing up and moving and establishing a new habit of movement, that is actually going to help you when it's time to increase the intensity or increase the duration of walking. First, we have to establish the routine of moving, and we want to make that as easy and painless as possible, because you've already been dealing with pain. You don't want to keep dealing with more and more, right? So we need to establish a movement routine that doesn't significantly alter where you're at currently. And then over time, it's kind of like the analogy of putting a frog in the water, right? And I don't know if this is true or not, but you turn the heat up and it doesn't really notice that the temperature is rising. It's kind of the same thing where you're just adding steps every week, every couple weeks, and all of a sudden you're feeling the same, but you're doing 10 times as much, right? So you're feeling the same. You were doing 100 steps and you were feeling okay. Now you're doing 1,000 steps and you feel okay. And then all of a sudden, you do that long enough, you get to like 5,000 plus steps, you're walking a mile basically, right? You're actually walking a little bit over a mile when you're doing that. So it's really important to establish the habit first, and that's by doing the smallest possible dosage that you can do without necessarily making things worse, and that helps to establish that habit. So that's how people should get started. And I think that's not just for exercise, that's for anything you want to do. Remove the barriers, we have this idea that everything has to be hard. And that if we're not working hard, then it's not worth it. But you don't have to die on that hill. In fact, there's lots of people who've died on that hill, and it's not a good hill to die on because you don't feel good doing it. Instead, if you want the actual outcome that you desire, don't die on the hill. Just take it nice and slow, and you will actually reach the outcome, as opposed to getting buried under the snow trying to climb Everest. So, yeah, that would be my main message on that one.
So start small, establish the habit, and then you can build from there. And even though those 200 steps a day may not physiologically change you, it allows you to take 300 steps and then 400 steps and then 500 steps and so on and so forth. So let's talk about habit formation. I know that's one of your areas of expertise. How do you establish those daily routines and daily habits?
Yeah, so first it is looking at, okay, what habit do I want to establish? How do I want to be, or how do I want to show up in the world? Like who do I want to be? So that takes a bit of introspection itself, right? Once you've established the types of habits that you want, and you've tied them to something that's important to you. So like for the example of, I want to improve my health, right? This is a habit that a lot of people want to improve for the New Year's, right? It's like, okay, well, why do you want to improve your health? Well, because I know it's good for me. Okay, well, why is it good for you? Well, because I have cardiovascular disease that runs in my family, and my father's had a heart attack, and I want to be there for my kids and grandkids when they get older. Okay, that's a pretty good reason to want to be healthy, but sometimes we have to really dig down into like, why is it really important for us? But that's not enough to establish the habit. Like, it's good to know why it's important to you, but then the next thing is we have to remove an all or nothing mentality. So what do I mean by that? Let's say that your goal is to walk 10,000 steps a day because you know that that's really healthy for you, and that's good for you and all that, right? And you say, okay, I'm going to do 10,000 steps a day, but you don't take the time to audit how many steps you're already doing. If you're only doing like 1,000 a day or less, doing 10,000 a day is going to be a 10x increase, 1,000% increase of what you are currently doing. That is an insurmountable goal for anybody. Like, you might be consistent with it for a couple days, a couple weeks, a couple months, but that's a huge shift. So what I recommend instead is, it's great to have a goal of like a big goal like that, but what's more important is, what is realistic right now for me? What feels easy to me? Like, whenever you're establishing a new habit, have your why, figure out what that is. And then the second step is, okay, how can I make this as easy as possible, where I could do it even when I'm chronically underslept, I hurt? Like, what's the amount that I can do on a day where I just feel horrible? That's the amount you should start with, because then on your good days, you can always increase as you feel comfortable. But you want to start with something that you could even do on your worst days, because that way, when they inevitably come around, you're not going to drop off and miss 1 day, 2 days, 5 days, because that's when it starts to become really difficult. Like, well, I didn't hit my 10,000 steps, so I might as well just give up. It's like, no. Let's start with, okay, your base was 1,000. Great. Let's start with 1,000 a day, right? That's how much you've been doing already. Now you're just cognitively aware of it. And then as you establish that and you can really stay consistent with it, then we can start to increase that over time. So, I'm using steps. It can be other habits, of course, but that's just an easy one to kind of wrap your head around. So number one, have your why. Number two, establish the lowest viable dosage. So like the easiest amount. And it could be like that you're walking for 2 minutes at a time, or 1 minute at a time, or something crazy easy. But again, it's about it's building your showing up muscle. And once you've built your showing up muscle, then you can start to increase the difficulty of it.
So we've discussed exercise, but what are some other daily habits that would help someone who's dealing with chronic pain, like your patient was?
Yeah, so there are a couple things. So another habit that Danielle was using was she actually did journaling. So she found that it was helpful for her to write down kind of how she was feeling, and just to be more in tune with what she was dealing with. Sorry, give me a second here. Give me 1 second. Yeah, so that was one thing that she had built a habit with. Her sleep habits as well. She started to change those too, trying to really focus on, okay, Instead of, staying up really, really, really late and, watching shows or just kind of winding down that way, I'm going to, reduce my time doing that. Honestly, the biggest things that she did were around movement. And then the rest of the time that we discussed, or that we were kind of having sessions and chatting about how to continue to make progress, was also around the mindset of somebody who can establish a new normal. So working on actually changing her belief structure around how long this will take, what is a normal response to exercise versus a not normal response to exercise. So this kind of moves from habits to more of like belief change. But we really had to dive into even the difference between muscle soreness and pain. Because if you had pain for a while, but then you get muscle soreness, sometimes you're not able to differentiate between the two, because just it's all pain at that point. You're like, well, I don't know. Is it muscle soreness? Is it not? And so we had to really fine tune the language that we were using too, of, okay, this is like pain. This is like the sciatic type pain versus this is more of like a discomfort. Like, yeah, okay, I did squats and my quads are sore. And so that's what that is. So kind of even redefining the language that we were using was important too. And so this actually was kind of a new type of habit as well, where instead of, and this is something I talk with a lot of my clients about, instead of kind of jumping to the worst case scenario and going down what I call the panic route of, pain onsets and then we just drop off a cliff, don't do anything. I encourage my clients to, when they do start having a flare-up or they're in the midst of one, instead of going down the panic route, trying to look at it from an analytical perspective. And that helps to remove the fear component, because you kind of have already expected it. Okay, here are the 3 or 4 things that if I do them, I know that it won't make it go away completely, but I know I can control some of it. And so just even changing her thought pattern on that, not going down the panic route, but going down more of the analytical route to really say, okay, I'm hurting. This isn't fun and I don't like this, but I know I can do X, Y, and Z to help control symptoms while my body figures out the rest. And so that was something we also worked on together, was identifying kind of what thoughts and beliefs she had that were kind of keeping her in that chronically flared up state, and then addressing those and kind of changing it.
I think mindset's really important in any goal, and particularly with regards to pain. Some of the leading researchers in the world, I think Laura Mosley was one of them. People who can reconceptualize pain, it predicts success, and people who can't, it actually predicts failure. So the ability to change your mind needs to come before you have the ability to change your body. We talked about gradual progression of activity. We talked about sleep. We talked about mindset. Where does nutrition come into things for people who are dealing with chronic pain?
That's a good question. I'm not an expert in the nutrition side of things. I generally rely on others for their expertise on this. There probably, from what I've read, there probably is some contribution of food in its relation to more of a low-grade chronic inflammation. But to what extent that is, I don't know for certain. Maybe you have more that you can add to that. My main recommendation for people is pretty simple. You should eat the foods that, number one, make you feel energized, right? Generally, those are not highly processed foods. Highly processed foods, like, depending on who you ask and what you read, people will say that, well, they're not they're calorically very very dense, and they have low satiety. So meaning like you can eat way more calories but feel less full because of just the way that the food groups are made up. And then if you eat more fruits and veggies, plus you increase your protein intake, and then you just have your normal amount of fats, pretty much like a basic Mediterranean diet, generally, if you don't have like Crohn's or something else, that tends to work pretty well for people. I think a lot of people they likely get into the weeds too much when it comes to nutrition, like trying to change every single thing, trying to take a bunch of supplements, all these different things, when really, like, if you just like, I try to keep it as basic as possible. If you just eliminate processed foods for the most part, increase the amount of leafy greens and fruits, increase your amount of lean meat proteins, and then have just your normal amount of saturated and polyunsaturated fats and monounsaturated fats, you're likely going to cover all of your bases. Now, this isn't talking about like weight loss or anything like that. That's a more, nuanced discussion as well. But for the most part, I think people probably get caught up in the weeds too much with nutrition, kind of looking for like, well, I think it's kind of along the same lines, like looking for the one specific exercise. Well, if I could just figure out this one food group that I'm that's causing my inflammation, it'll just all make it go away. But I just haven't seen it happen. I just like, I just haven't seen it happen with clients. And maybe there is that one person out there, or a few people out there, where they do need a very specific dietary change, but if somebody's eating like a really healthy Mediterranean style diet, or just, I hate calling it even a diet, but if that's just the way that they eat, I haven't really seen anybody make huge strides by completely switching that.
Yeah, I do agree that people tend to get caught up in the weeds too much. There are like people with autoimmune conditions that have food allergies or food sensitivities to certain groups. And I'd say those are probably more the exception than the rule. But in general, I think if you clean up diet, try to eat foods as close as they were in nature and not highly processed. Get all the green leafy vegetables, lean organic proteins, omega-3s, you keep your water up. That helps most people. And then if you have all that in place and you do need to supplement that, that's when it's time to start delving into supplements. But I think
Correct.
people do go looking for the magic bullet a little bit in well, if I just had this one thing, this one exercise, this one back brace, this one supplement, then all my pills would go away. And I hope this isn't a spoiler to anyone listening, but none of those things exist. There's usually not one magic bullet. It's just, like you said, consistency of doing a lot of little things right over time for most people.
Yeah.
So what other resources would you recommend to someone who wants to improve their daily habits, whether that just be to be healthier coming into the new year, or to move more, or to get rid of some chronic pain that they have?
I'm just going to give one recommendation, because if I give too many, people have paralysis. What is it? Paralysis by analysis. So read the book or listen to a podcast episode with James Clear. He's the author of Atomic Habits. You will never need to read another habit book in your life. You can even just, if you don't like reading books, listen to the podcast. If you don't want to listen to the podcast, you can even look at like the Cliff Notes. It gives you a very easy to follow habit formation strategy that you can implement. And again, it is a bit of shifting your belief structure that things have to be hard. Things don't have to be hard. Things are just as hard as you make them. Some things are inherently hard, right? If you want to train for a marathon, it's probably going to be difficult. There are going to be times that are challenging. But if you're just trying to establish a new habit to get healthier, to reduce your pain, to be more functional, to create a new normal, follow that book, is excellent. So that would be my recommendation. My one recommendation: check out James Clear, Atomic Habits. You can he's awesome, and I've learned a lot from him, and a lot of my habit formation strategies that I use with clients is actually from him. So.
Well, thank you for that. And if anyone would want to get in touch with you, how would they go about doing that?
They can go ahead and just shoot me an email. They can also reach out to me on Instagram, LinkedIn, all these different platforms. My email, we can put that in the show notes also. But it's basically nathan@catalystpt.com. Catalyst is spelled a little bit different, like my business, but we'll have that in the show notes, I'm sure. And yeah, that'd be the easiest way to get in touch with me if you guys need some help.
All right. Well, thank you so much for taking the time to share your knowledge with us. And I hope you have a great day and a happy, healthy new year.
Thanks for listening to the St. Louis Pain Expert Podcast. We hope you've enjoyed the show. If you live in the St. Louis area and would like Dr. Candy's help to find a solution to your pain, visit our website at stlpainexpert.com. Email Dr. Candy at dave@stlpainexpert.com or call Dr. Candy's clinical practice at 314-941-3970. If you're listening from outside the St. Louis area but would still like some help, feel free to contact us to learn more about our virtual health coaching. Regardless of where you live, please share our podcast with anyone you know who would benefit from learning more about pain and what can be done to relieve it. And don't forget to subscribe to our podcast on iTunes, Google, Spotify, or your other favorite podcast platform so you get notified when we release a new episode. Thanks again for listening, and we hope you'll enjoy us again soon.